This video is an overview of how to acquire blood pressure measurements using the Midmark IQvitals Zone Vital Signs device. Always refer to the appropriate technical documentation for the complete list of instructions, safety alerts, and sequence of procedures before conducting any service or maintenance operations. Initiating BP. The following guidelines are based on American Heart Association recommendations. Prior to initiating a blood pressure measurement, be sure to allow the patient to sit quietly for at least 5 minutes before taking the first measurement. You will also want to ensure that the patient is seated comfortably, in a chair that supports their back and arms, with their legs uncrossed and feet flat on the floor. During the measurement, support the patient's arm, keeping the cuff at heart height. To help keep the patient relaxed during a blood pressure measurement, instruct the patient to refrain from talking or moving. You should also refrain from engaging the patient in any conversation during measurements. BP cuff selection. Using the proper size blood pressure cuff is important for accurate blood pressure readings. We recommend using only Midmark reusable or disposable cuffs with the IQvitals Zone device. Cuffs that are too small may result in erroneously high blood pressure readings, while cuffs that are too large may result in erroneously low blood pressure readings. To verify the proper cuff size for a patient, wrap the cuff around the patient's arm. The index line, white arrow, should fall within the white range markings on the cuff. If a patient falls between two cuff sizes, always use the larger cuff. Proper application and positioning of the BP cuff. The measurement site for adults and children is the upper arm. Do not wrap a cuff over a patient's clothing. Inaccuracies can occur. The middle of the cuff should be positioned level with the right atrium of the patient's heart. Place the cuff brachial artery marker over or close to the brachial artery. For best results, wrap the cuff snugly so that there is room for no more than 2 fingers under the cuff. BP modes. The NIBP mode drop-down menu provides the user with up to 6 choices for blood pressure mode: spot, interval, continuous, averaging, sprint, and custom. The user may elect to disable all blood pressure capture modes in the NIBP tab within the settings menu, but spot mode will always be available. Spot mode takes a single NIBP reading. Interval mode takes an NIBP reading after each user selected interval until the user elects to finish the monitoring session. Continuous mode takes continuous blood pressure measurements over a maximum time frame of 5 minutes. The cuff will deflate and pause for 10 seconds before the next measurement. Averaging mode takes a series of 5 readings, disregards the first reading, and averages the next 4 readings to report an average blood pressure reading. Once sprint mode is initiated, the screen displays a checklist to help ensure proper patient positioning techniques are followed. The technician may then leave the room, so the patient is undisturbed to help reduce white coat hypertension. When the preset delay start timer expires, the IQvitals Zone device automatically captures 3 blood pressure measurements and produces the average reading. Custom BP mode allows customization of the sprint BP mode to reduce the delay start timer. Set the interval between measurements, discard the first measurement, and average more than 3 measurements. To make these customizations, see the NIBP tab in the settings menu. The IQvitals Zone device comes with 2 NIBP algorithms: linear deflation and step deflation. Linear deflation. During linear deflation, the device will rapidly inflate the blood pressure cuff and take an estimated systolic reading while still inflating, reducing the chance of over or underinflating the cuff. The estimated systolic reading is then quickly translated to a maximum inflation pressure by adding 30 millimeters of mercury to the estimated systolic reading, telling the pump when to stop inflating, and potentially saving the patient from the uncomfortable feeling of extra pressure in the cuff. Once the maximum inflation is reached, the cuff begins to deflate at a rapid pace, determining the systolic and diastolic pressures during the deflation period, making it faster than the step deflation algorithm. This also reduces the amount and duration of cuff pressure on the patient. Please note that linear deflation is only available with the spot BP capture mode. To start a blood pressure measurement using the linear deflation setting, press the Start NI-BP button on the upper right corner of the main screen. Step deflation. When a blood pressure measurement is initiated using step deflation, the device will rapidly inflate the blood pressure cuff to the user-selected maximum inflation pressure. Once the maximum inflation pressure is reached, the cuff begins to deflate incrementally at preset pressure steps. Since the deflation is done in a slow, stepwise fashion, this may take longer than linear deflation to finish the blood pressure measurement. When taking a measurement using step deflation, the user must select an initial inflation value, which will then begin the reading. Depending on the NI-BP mode selected, either 2 or 4 initial inflation pressure buttons will display in the upper right-hand corner of the main screen. To start a blood pressure measurement using step deflation, press the appropriate inflation pressure button on the main screen. Please note that ideally, the initial inflation pressure should be about 30 millimeters of mercury above the patient's systolic pressure. Using a higher inflation pressure may cause the patient unnecessary discomfort. Choosing an inflation pressure that is too low may cause the device to reinflate the cuff in order to obtain a systolic pressure. There are 4 factory preset inflation pressure buttons for adult patients: 140, 160, 180, and 220. When in continuous or interval mode, 160 and 220 will appear on screen. These values can be changed in the NI-BP tab of the Settings menu. There are 4 factory preset inflation pressure buttons for pediatric patients: 110, 120, 130, and 140. When in continuous or interval mode, 120 and 140 will appear on screen. These values can be changed in the NI-BP tab of the Settings menu. Spot mode. To capture a blood pressure reading using spot mode, select Spot from the NI-BP mode drop-down menu. Then press Start NI-BP or select an inflation rate, depending on your deflation mode, to start the reading. During an NI-BP reading, the NI-BP mode drop-down menu becomes inactive. When a blood pressure measurement is started, the Start NI-BP or the initial inflation pressure buttons, if you are using the step deflation method, changes to a red Stop NI-BP button. To stop a blood pressure measurement at any time, press Stop NI-BP. When the measurement is stopped, the cuff will deflate and all buttons will then be enabled. While the blood pressure measurement is running, the progress wheel icon will appear under the systolic and diastolic field. The systolic and diastolic values appear on the screen when the blood pressure measurement is complete. The pulse rate will appear below the pulse (BPM) when a blood pressure measurement is complete. Press the Save button to store the data into the patient record. Interval mode. To initiate a blood pressure measurement using interval mode, select Interval from the NI-BP mode drop-down menu on the main screen. When interval mode is selected, a drop-down menu will appear allowing you to select the interval time. Press the down arrow in the interval box to select the length of time between interval NI-BP readings for this session. The options are 1, 2, 3, 4, 5, 10, 15, 30, 60, or 90 minutes. The interval time selected will be displayed in the interval data window. Once you selected the interval time, choose an inflation rate to start a blood pressure measurement. Once the inflation rate is selected, the interval time drop-down menu becomes a stop button and the inflation rate button becomes a finish button while the measurement is underway. A countdown timer to the next reading is displayed in the top right above the finish button. Press the stop button at any time to stop a blood pressure reading and the current interval measurement session. Between interval readings, the data from the most recent NI-BP reading is displayed. The remaining time displayed in the upper right corner above the finish button shows the time remaining until the next measurement. Select an inflation rate at any time to initiate a reading between set interval readings. The rest of the interval session will resume after the end of this measurement. Press Finish at any time to complete the entire interval monitoring session. After an interval session has finished, you may press the Review button to see the data from the interval measurement session or select an inflation rate to continue with the rest of the interval session on the current patient. New measurements are appended to the end of the last measurement list. The total number of readings recorded during the session is displayed in the upper right corner of the main screen. Press the Review button to view the interval session data. Data from the interval session is displayed in a scrolling list format. Any alarm that occurred during each measurement will be listed in the far right column. IQvitals can only save one entry from a monitoring session into a patient record. Please note that the device does not keep a perpetual log of alarm occurrences. Once the session is ended or a new monitoring session is started, the displayed alarm data will no longer be available. To select the measurement to be saved, press the row of the entry to highlight the data, then press Select. The data is then displayed on the main testing screen. Continuous mode. Please note that continuous mode takes continuous blood pressure measurements over a maximum time frame of 5 minutes. The cuff will deflate and pause for 10 seconds before the next measurement. To initiate a continuous blood pressure measurement, select Continuous from the NIBP mode drop-down menu. Choose an inflation rate and the blood pressure measurement will begin. The inflation rate button will change to a stop button, and a countdown timer showing the remaining time left in the continuous measurement session will be displayed in the top right, above the Review button. While the blood pressure measurement is running, progress wheel icons will appear under the systolic and diastolic field. To stop a blood pressure measurement at any time, press the Stop button. The Stop button will change to an inflation rate button. When the blood pressure measurement is complete, the systolic and diastolic values appear on the screen. A pulse rate will be displayed when the blood pressure reading is complete. The pulse rate will appear below pulse (BPM) on the screen until the next measurement begins. The Review button becomes enabled at the end of the continuous session, or if the Stop button is pressed after at least one monitoring record has been obtained. Please note that the Clear button will clear all the continuous monitoring session data. The user should save measurement data to the patient record if desired before clearing the data. Averaging mode. To initiate a blood pressure reading using the averaging mode, select Averaging from the NIBP mode drop-down menu on the main screen. Choose an inflation rate and the blood pressure measurement will begin. When a blood pressure measurement is started, the inflation rate button changes to a red Stop NIBP button. The system takes 5 blood pressure measurements and displays each measurement in sequence. A countdown timer to the next reading is displayed in the upper right corner above the Stop NIBP button. At the end of the session, the system ignores the first measurement and displays the average of the last 4 of 5 measurements. The data is then displayed on the main screen. To stop a blood pressure measurement at any time, press Stop NIBP. A reading count will appear in the upper right above the Stop NIBP button. When each blood pressure measurement is complete, the systolic and diastolic values are displayed on the screen, as well as a pulse rate. The pulse rate will appear below the pulse (BPM) on the screen. The Clear button will allow you to clear all monitoring session data. Sprint mode. To initiate a blood pressure reading using Sprint mode, select Sprint from the NIBP mode drop-down menu on the main screen. Choose an inflation rate, and the blood pressure measurement will begin. The BP protocol in progress screen appears with a 5-minute countdown timer in the lower right corner. The screen includes a checklist for patient positioning as recommended by the American Medical Association to help ensure a more accurate blood pressure reading. The system takes 3 BP measurements after a 5-minute delay with a 1-minute interval between measurements. At the end of the protocol, the system displays the average of the 3 BP measurements. The main screen appears after the 5-minute delay. The NIBP mode dropdown becomes inactive, and the inflation rate button changes to a red stop button. While the BP measurement is being captured, a reading count appears in the upper right corner of the display. All of the buttons, the alarms dropdown, and the NIBP mode dropdown are disabled until the protocol is completed or canceled. To stop a BP measurement at any time after the initial delay, press Stop. When the measurement is stopped, the cuff will deflate and all buttons will be enabled. When each BP measurement is complete, the systolic and diastolic values are displayed on the screen. A next read timer is displayed in the upper right corner of the screen. This is the time remaining until the next measurement. The pulse rate will appear below pulse rate BPM on the screen. When the sprint protocol is complete, the average of 3 BP measurements and other data are displayed on the main screen. The total number of BP readings is displayed in the upper right corner. You may press the Review button to view the list of all acquired BP measurements from the current session. All data on the review screen will be discarded when any of the following selections are made on the main screen: Save, Clear, any other NIBP mode, or Device Power Off. Press Cancel to return to the main screen. Press Save on the main screen to save the averaged BP measurement into the patient record. Custom Mode. To initiate a blood pressure reading using the Custom mode, select Custom from the NIBP mode drop-down menu on the main screen. Choose an inflation rate and the blood pressure measurement will begin. The BP protocol in progress screen appears with a customizable countdown timer on the lower right corner of the screen. The screen includes a checklist for patient positioning, as recommended by the American Medical Association, to help ensure a more accurate blood pressure reading. To cancel the custom protocol at this time, press the Cancel button. The system will take a preset number of BP measurements after a preset delay, with a preset interval between measurements as defined in the custom settings. You may pre-select to discard the first reading in the custom settings. See NIBP settings for more information. At the end of the session, the system displays the average of a predefined number of BP measurements. The main screen appears after the preset delay. The NIBP mode drop-down menu becomes inactive and the Start button changes to a red Stop button. While the BP measurement is running, a reading count appears in the upper right corner of the screen. All of the buttons, the alarms drop-down, and the NIBP mode drop-down are disabled until the protocol is completed or canceled. To stop a BP measurement at any time after the initial delay, press Stop. When the measurement is stopped, the cuff will deflate and all buttons will be enabled. When each BP measurement is complete, the systolic and diastolic values are displayed on the screen. A next read timer is displayed in the upper right corner. This is the time remaining until the next measurement. The pulse rate will appear below pulse rate on the screen. When the custom protocol is complete, the averaged BP measurements and other data are displayed on the main screen. The total number of BP readings is displayed in the upper right corner of the screen. You may press the Review button to view the list of all acquired BP measurements from the current session. All data on the review screen will be discarded when any of the following selections are made on the main screen: Save, Clear, any other NIBP modes, or Device Power Off. Press Cancel to return to the main screen. Press Save on the main screen to save the averaged BP measurement into the patient record. For more detailed information about how to initiate blood pressure measurements with your device, please refer to the IQvitals Zone User Guide. For further support, contact Midmark Technical Support at 1-844-856-1230, option 2.